So now, my pleasure to introduce Dr. Rick Audas to talk us through plans for the Big Data project in the second tranche. Kia ora.
Kia ora, everybody. Kia ora again. So this afternoon, I'm going to talk a little bit about the work that we've been doing in terms of thinking about where we go next with and trying to build on the things that we've... Sorry, am I close enough to the microphone? I'm trying to be close enough to the microphone but see my slides at the same time. Sounds a bit better now. And see the time as well. So, okay. So we've been doing, well, as many of you probably were involved with, we've done a series of regional sandpits around the country, and I was actually able to go to all of them, and that was actually really useful because I was able to talk to lots of different people and get lots of different perspectives on what they think we ought to be doing next and the focus that we should take and the kinds of things that we should be thinking about. So what I really want to outline is more sort of, not really a set of things that we're going to do, but kind of a way in which we're going to do things. The more we sort of dig into the data and the more we talk to people and the more we learn more and the more stuff gets into the IDI, the more opens up what opportunities that of things we can pursue. So we kind of thought we'd focus more on how we do things as opposed to sort of what we're going to do. So what have we learned so far? Well, I've talked a little bit about this morning, but one of the things to highlight is that first and foremost that the IDI is a really powerful and useful tool in terms of understanding the lives of young people and the good and bad things that happen to them. One of the things that we found is that working in large collaborative teams is challenging and time-consuming, but it results in better science. And I think that all of the work that we've done, which has involved collaboration across the teams, is better as a result of having collaboration. I'm reminded of something that my colleague Barry Millen said, is they've never heard of a paper getting worse by having more people involved in it. And that's really, I think, been true with our work. That not everything that we'd like to have is in the IDI. So again, while I think a lot of people kind of think that everything is there, not everything is there. Not all the data that's collected by various government departments or agencies all ends up inside of there. And then there's other sort of crucial data points in people's lives that we don't miss. So for instance, in terms of understanding obesity, we've really only got one systematic capture at age somewhere between the child's 4th and 5th birthdays. Again, we think that's kind of inadequate in terms of understanding longer-term trajectories. So again, that's given us certainly some pause for thought and understanding what we can do, but of course also the limitations of where we are. So what are better outcomes going to look like? What do we mean? We're very focused on sort of outcomes-oriented research. What do better outcomes look like? Well, we think that we want to take a little bit of in terms of thinking about the next tranche of research, thinking about what the world is going to look like in the future. What are we actually sort of, what are the children today going to be facing? And it's going to be a rather different world than I think that we face. Their world is going to be one that's going to be dominated by things like issues around climate change. So we talk, a lot, of course, in the media these days about rising sea levels. What impact is that going to have on living environments? How is that going to change the way people interact with their environment? Increasing competition for scarce resources. So if we've got increasing tides, we've got less land, but population growth remains unabated. So we've got more people competing for scarce resources. We've got increased integration across economies. So one of the things that we know is that increasingly informational barriers that may have kind of isolated us in the past will cease to do so. So very much we live in a world that is very connected. And again, increasing automation. More machine learning, more artificial intelligence, and fewer jobs, and perhaps different jobs than we've had before. So again, one of the things that we really want to think about is how do we sort of produce that next generation of children who are able to compete and thrive in this world, which to say is going to be a rather different one than the world we're in today. So what do we want to learn? Well, we really want to focus on how to improve lives. And I think if there's one thing that underpins everything we do, is trying to figure out how we make people's lives better. We want to achieve greater equity because we think that it's a pretty hollow accomplishment to improve the lives of some people, but to leave others behind. And we want to prepare for the future. And we've seen a healthy, educated, resilient population as being the key to future success, both individually and collectively. So how are we going to do this? Well, we've identified several thematic areas that we think sort of defines the way we want to do our research. And one of the things that sort of jumps out, and again has been a recurrent theme today, is not about us without us. So again, very much a focus that in terms of trying to understand Maori research, understand the aspirations of Maori, understanding Pacific research, the aspirations of Pacific, we can't do that without Maori researchers. We can't do that without Pacific researchers. We can't do that without Maori stakeholders. We can't do that without Pacific stakeholders. So we absolutely need to seek to support aspiring Maori and Pacific researchers to engage with the elders that know and understand the aspirations of the communities, to engage with whānau and community agencies. So we've got a better understanding of what the aspirations of these communities are and how that we can leverage the data resources that we have to get them. How do we improve the data resources that are available so that we can address them? And again, and I think there's a recurring theme, if the data doesn't answer the right doesn't answer those questions, then we need to get better data. We need to go back and think about the data that we've got, and we need to advocate for that. And I think if everybody in this room and the people that are affiliated with this research, if we all put our heads together and put our minds together, I think that's something that's very achievable. But it needs to be something that we would work on collectively. Microsimulation and economic analysis. So again, we really want to be focused on trying to answer what we call the what-if questions. So what if we can improve rates of obesity by 10%? What if we can improve rates of literacy by 10%? What if we can lower or better manage mental health conditions? How would this actually improve society? And this very much takes a kind of social investment point of view, which ties in the economic analysis. So understanding that investment in prevention, investment in early intervention is going to be cost effective in the long term. And I think this is something that governments resonate or resonates with governments, that they appreciate that if we spend $1 now, we save $10 down the road. And I think that in an economy that is doing as well as New Zealand's, we can have those discussions and say, look, there are a lot of areas where we're falling short, and with relatively small investments now, save a lot of money in the longer picture, or in the longer term. Life course research is, of course, a recurring theme. So we fundamentally had a better start, and we're all here because we believe that if we intervene with children and we actually get better outcomes for children, we're going to produce more productive, happier, healthier adults. And we believe that over the longer that people stay on a trajectory towards those things, the harder it is to get them off of that trajectory. So we think intervention early is crucially important. Community assets, and again, one of the things that we've talked about a lot in terms of the data is our ability to look at individuals and look at what happens to individuals, and particularly with their interactions with all kinds of government services. But what we don't really have is a really good picture of how people interact with their community. What are the things that they're exposed to? So again, do children have the same access to playing space? Do they have the same access to libraries? Are they overexposed to fast food restaurants? Are they overexposed to crime? Are they overexposed to gambling outlets, to alcohol and tobacco and things of that nature? These are things that we have a pretty good feel that we can systematically capture at a geographic level and actually paint an important picture of the impact that these exposures play on the outcomes of kids. And we think that focusing on a community level gives us a much more natural policy avenue to follow. We're really curious and intrigued by social media data. And again, one of the things that we've in talking to a lot of people, and certainly the buzzwords that float around is how much data is out there, how much data is being captured in social media, and how it can be available to use for research purposes. And we fundamentally, believe that there's potential to use this data to predict things from happening before they happen. So then one of the things that we're really good at doing using the IDI and things like and other sort of large data sources is actually modeling, saying, well, we now understand why that happened. We think that with social media data and potentially with some of the information that's available in it, we can potentially pick up things happening before they occur and target interventions more effectively that way. So again, we're intrigued by the possibilities there. Collaborations, again, we're going to continue to work closely with our thematic partners to identify research priorities and to advance an ambitious scientific agenda. We're trying to develop increasing partnerships with other national science challenges, particularly within the health challenges, with common interest in life course research, but also common interest in community assets as well, because we believe that not only will they have an impact on children, they're going to have an impact on adults and seniors as well. To work with other researchers in New Zealand, again, to develop a data set of community assets that can be shared. And we very much see this as being a public good, something that we're eager to create, but we don't want to hold the license or the monopoly on it. Well, once that data is created, we want it to be available to all researchers. We think there's more than enough problems to look at that we don't need to hoard this data for ourselves. And again, building international collaborations. That really, the IDI is something, and I can speak from this coming from another country, the IDI is not something that exists everywhere else. Most other countries don't have access to data of this kind where we can link individuals across multiple government departments and really get a very multifaceted and interdisciplinary perspective on their lives. And we're very privileged to have that, but we also understand that we have to make good with it. It's a privilege that's been granted to us, but it's a privilege that can be taken away. And if we can't demonstrate the efficacy of using this data to actually better New Zealand, then it's an asset that's potentially lost.